why someone would need a crown. One, if the filling that is currently there is just too big, to replace it would compromise the integrity of the rest of the tooth. Then a crown is indicated. If the cavity is there and there's no existing filling, the cavity would just be too big for that to happen. Then a crown is needed. If the tooth is broken, depending on the severity of the break, usually a crown is needed. Sometimes they're small enough that a filling is fine. So those are kind of the whys. If you ever get a root canal, most of the time it needs a crown on it as well. So those are the whys. What you would expect, you get numb, so needle, unfortunately. Can't get away from that. So you're super numb, don't feel a thing. I do a bunch of magic with water and my wand and all that. You get a temporary crown for a couple of weeks, which is basically made out of plastic, custom fit to you on that tooth or teeth if we're doing more than one. That goes on with kind of a temporary cement, so that when you come back in a few weeks, we pop that off and put on the real one. The real one's made out of zirconium most of the time. Sometimes I'll do gold. I prefer that. I got one. But zirconia is the go-to material of choice these days. It's super hard, very aesthetic. So that's kind of what to expect. And usually that second appointment, getting the real crown put on and the temporary taken off, most of the time you don't need to get numb. Some people like to, just to prevent any sensitivity.